Brian Lehrer on WNYC. You know, when people come into the country seeking political asylum, they're often dealing with intense physical and emotional injuries from, let's just say it, torture in their countries of origin. And if those people are arriving in New York City, it's highly possible that they'll be sent to the oldest public hospital in the country, Bellevue, which houses something called the Program for Survivors of Torture, or PSOT. The overwhelming majority of patients in this program are asylum seekers, so it caters to a particular set of needs, documenting and treating injuries, connecting patients to social workers and lawyers, and providing mental health care, for example. Now, earlier this year, NYC Health and Hospitals announced that it would close the program in mid-May. Obviously, that's coming right up. One of the main reasons they cited for that decision is that the program is federally funded, which means there's a possibility that the Trump administration could eventually require the hospital to turn over patient data, including their immigration status, as they seek to deport as many asylum seekers as possible in Trump's mass deportation program. And again, the overwhelming majority of the program's patients are asylum seekers with tenuous residency status often. The city says that patients who would normally qualify for this program will still receive the treatment they need elsewhere at Bellevue, but a lot of longtime PSOT staffers say that the particular set of resources that the program provides to victims of torture cannot be replicated in a piecemeal way. And of course, this is all happening amidst a backdrop of growing ICE presence in New York City, even though apparently Mayor Mamdani and President Trump talk on the phone, and across the country, even including at hospitals. So we've got two guests with us today to talk about Bellevue's program for survivors of torture. First, Dr. Alan Keller, who founded the program back in 1995 and has been pushing the city to reverse its decision. He's also Associate Professor of Medicine and Population Health at the NYU Grossman School of Medicine. And we're also joined by a former patient of the program who we're just going to call Ibrahim to protect his privacy. He's an asylum seeker who came to New York from a country in Central Africa about 8 years ago. Dr. Keller and Ibrahim, welcome to WNYC.
Thank you so much. A privilege to be here.
Thank you so much. I'm happy to be here. Thank you for having me.
So, Dr. Keller, tell me about why you founded this program. What felt important 30 years ago about concentrating these services in such a specific track?
Well, when our program was first started, right before, I'm a primary care physician at Bellevue. And right off the bat, I will just say I consider Bellevue to be the greatest hospital in the world. It's a city on a hill. No one gets turned away. So back in 95, when I was a primary care doc, I would get a lot of requests by groups such as Physicians for Human Rights to evaluate individuals who are alleging torture and mistreatment. And they'd say, oh, they have a burn mark, or they have a place where they were beaten, a broken bone. They're blind because they were forced to look into the sun. Can you document that? And so I started seeing them and doing that because that documentation can really be crucial in whether or not they're getting granted asylum and, frankly, whether or not they're being sent back to their torturers. But at the same time, as a primary care physician, I realized there's a lot more going on than simply me documenting, that they have a lot of serious health problems, both physical, psychological, and also social. And at the time, I was working in the primary care clinic, and I realized there were other clinicians in other disciplines seeing the same thing. One of the colleagues with whom I founded the program, Dr. Asher Alajim, who is a psychiatrist and just one of the wisest souls I know, he and I connected, and it was like, wow, we're both seeing the same people. Then there was a social worker at the hospital and a psychologist. And we were like, wow, we're each seeing these. And we were like, you know what? Let's talk. Let's come together. And so we've been doing something not always so common, that we talk to one another. And so the model we built is one of providing comprehensive interdisciplinary care. And by interdisciplinary, I mean you have different disciplines, the medical to deal with the muscle aches and backaches, the psychological to provide a safe space to share what happened, the social because of fears of homelessness, and then the legal, how to be safe. And what we did, and I think we've really done well, is connect the dots. And so we as a program have been doing this for 30 years, and it's really gratifying, and it's a privilege because we get to care for folks like Ibrahim.
And Ibrahim, I see you came here in late 2017. To the extent that you're comfortable saying anything about this, what were you dealing with at home that drove you to come to the United States and seek asylum? And I see you started treatment at the Program for Survivors of Torture at Bellevue shortly after you arrived. So maybe you can tell our listeners about what that experience was like.
Good morning again, and thank you for having me. Yes, I came back in 2017 in this country. I fled my home country. I fled a persecution, and then when I arrived here, and I lived in very, very isolated program, and then I feel very isolated and unsure for my next step. And then through the community here, I learned about the program in the Bellevue Hospital, and then I joined the program in 2018, and the program has been very, very, very helpful for me.
Can you give an example of how?
The program is giving an example, for example, like they giving primary care, and then stressed, and they are providing all the basic need for support.
So, Dr. Keller, as I mentioned in the intro, it seems like the main reason the city is trying to shut down the program for survivors of torture at Bellevue Hospital is not because they don't like it, but because Bellevue administrators became concerned that accepting the federal grants they get might come with strings attached and put the hospital in a position where they'd be forced to disclose data on their patients' immigration status to federal agencies, making deportation more likely. So, do you agree that the decision is motivated by that desire to protect the patients in that way?
Well, first I'll say these are really, really scary times. I've been doing this for over 30 years, and I've never seen my patients or my colleagues more frightened. And so I understand that. And yes, those are the reasons that the colleagues who are leaders have given. And I know they're doing what they believe is right and to protect this system. But I think we can't preemptively surrender, and that this money, it actually comes from a federal bill, a law called the Torture Victims Relief Act, passed in 1998. And I hope I'm not committing treason by saying this, but the sponsor of that bill was Congressman Chris Smith, a Republican from New Jersey. And I'm way on the other side. But I consider him one of my heroes because he got that these individuals who suffered so much need appropriate specialized care. And that's what we have been providing. And so actually the funding that is used to support this program is actually the only criteria is that you were tortured outside of the United States. And we don't have to collect individual information or report it. We report information in aggregate, but we are very careful that there's no identifying information. So I get that the concerns are real, but in a sense, because those concerns are real, that's why our program is needed now more than ever.
Listeners, we can take some phone calls on this if we get any. if you can help us report this story, have you or someone you know been an asylum seeker in the United States because you were escaping anything that you would call torture? Tell us what services were available and what services you think should be. 212-433 WNYC, 212-433-9692. Clinicians, patients, anyone who's worked at Bellevue in particular, but not only at Bellevue. What do you think of the decision to close the program for survivors of torture? Have you worked with or been a patient in the program? What was that experience like? Or maybe you're a lawyer or social worker who's had a close relationship with the clinic. Do you think the city's being prudent, protecting patients from the Trump mass deportation machine, or rash and wrong-headed in doing away with this program? You can call or text with your thoughts or stories at 212-433 WNYC, 212-433-9692. Call or text for Dr. Keller, the founder of the program, and Ibrahim, one of the people who came here a number of years ago and was able to get the benefit of its services. Dr. Keller, the NYC Health and Hospitals is saying that just because the program is closing, that doesn't mean patients who would normally qualify for this program will be turned away from Bellevue. Their treatment would just be spread out across existing services in other departments at the hospital. So they say there would be no, quote, disruption of care. Why doesn't that assuage your concerns?
Well, first of all, I have no doubt, having been at Bellevue since I was a first-year medical student in 1982, that my beloved Bellevue will always do what's right. And I have no doubt that those services will be available. I think what's special about what we do is that the program was created. And by the way, we've had the privilege of caring for over 10,000 men, women, and children like Ibrahim from over 100 countries. And it's not a matter of that the appropriate care will be delivered. It's that what was happening before our program. Number one, individuals were not being identified. We did a study showing, like, torture survivors were showing up in clinic, in the ER. Nobody knew they were there. So it's not about the individual care. It's about really connecting the dots and doing this together. Every one of our patients, when we have a new referral, and individuals are referred overwhelmingly by word of mouth, by attorneys, and because they know we're safe. And safety is something we've worked really hard over the last 30 years to develop. But when we do an intake conference, around the table, we have physicians like myself, psychiatrists, psychologists, legal service providers, and we're from the very minute starting to, figure out how to work together. We're all located in the same area. And so we talk to one another. If I have a patient that's got these horrific nightmares, I walk across the hall to Dr. Elijah. I say, okay, what medication you think given these symptoms? And then he goes next door to our legal service provider, a fellow right now named Bakari, to say, okay, this guy is really nervous because he doesn't have a lawyer. So even if you provide the services, and that's great, and I'm really grateful that I have confidence they'll do what's right. But I guess we started 30 years ago because there was a problem. It wasn't working. Even though the services were there, individuals didn't know about it, weren't getting referred, and weren't getting cared for holistically. Why would you go back to, to a silo approach? And I'll say I consider it the greatest privilege of my life to work at Bellevue. And I hope I haven't pissed too many people off because I want to be carried out of that place in no time soon. And, here's something about Bellevue, a defining moment. During Hurricane Sandy, the hospital had to be evacuated. The electricity went out. And my colleagues formed what we fondly referred to as a bucket brigade, where buckets of fuel were passed up a stairwell to a generator on the 13th floor. And that image of like Bellevue as a community, not just individuals, but a community,
And
is the heart and soul of what we do.
and we have some members of that community in one way or another calling in and texting us. And let's talk to Jacqueline in Manhattan, a translator at Bellevue, apparently. Hi, Jacqueline. Thank you for calling in.
Hi, Brian. So I have been working on a contract, as French interpreters always do at Bellevue, and I often work for that clinic. And on Friday and on Monday, we were given the task of calling all the people who are French-speaking, that is, all the Africans, survivors of torture, to tell them that the services are not changing. However, the name of the clinic as of May 15th is changing. I think in English you would say the Human Rights Primary Care Clinic. They were told that all of their services will remain the same, their doctors, except maybe one or two. They called 800 people. We did it on Monday. We had to wait for city approval. We sat there all day Friday and waited. And on Monday afternoon, we made all the phone calls. So maybe that's something to know.
Well, are you concerned? I don't know if you've studied up on it enough to have an opinion, but whether that new program under its new name will provide the services that the old program did sufficient, or maybe you think this is an example of Bellevue sort of obeying in advance, as they say, to what the Trump administration might threaten them with.
Well, what I do know is that in the text that we read them, we told them that whether you're receiving mental health care, medical care, help with immigration, you will still receive the same services. The
Thank
city,
you.
2:30 on Monday afternoon. That's all I know.
All right. Thank you very much. Let's go to Catherine in Brooklyn, who says she used to volunteer in this particular program. Catherine, you're on WNYC. Thank you for calling in.
Hi, my pleasure. I guess that last caller's comment sort of complicates my question, but I used to volunteer as an English teacher there, and I think it's a wonderful program, and I'm wondering if it's a done deal, that it's shut down, or if there's anything we can do as citizens to advocate for keeping that program going.
Ibrahim, can I bring you in on this? Do you have an opinion? I see that you spent a lot of time at Bellevue in 2018, but I gather you're still in touch with Dr. Keller, and you seem to have an ongoing relationship with the program, even as you're still applying for political asylum in this country, if I understand correctly. So what do you think about all this?
Yes, sir. I can't even believe myself, like when I heard this news, like how it affected me, because I've been known these doctors, Dr. Aladdin and Dr. Smith, for so many years, and then I've been working with them. I built a trust, and it's not easy for someone like me to build a trust with someone and open his heart and saying everything that what is happening to me, and it's very tough. And when I heard that they're going to change some doctors and they're going to close the program, and I cannot even sleep properly now. I can't believe why Bellevue Hospital is taking such a decision, but like it's affected me deeply. Deeply it affected me, and I can't believe it. And also these doctor, like Dr. Aladdin and Smith, both are French speaking and English, and it's easy for me to communicate with them, and I can express myself to them. And I really feel very, very awful, like Bellevue is taking this type of decision.
So do you think, Dr. Keller, to the caller's very specific question, that there's anything people who care about this decision can and should do before it's actually implemented, if it's implemented on schedule in a few days?
Well, you can't work at Bellevue without being hopeful and optimistic. And I do appreciate my colleague, the interpreter, Jacqueline's call. I think it was important to note that, she was given a script and it's important. And then she acknowledged, quote, "That's all I know." And the answer to this, and I appreciate how Bellevue is really trying to do what's right, But I think it was a bit reactive to some of the pushback they've already gotten that these calls were made. And I'm concerned just telling everybody everything's going to be okay is not enough, because our program, the expertise, my colleagues have been doing this, the total expertise is hundreds of years. It's not overnight. And I guess the question I'd have is, even if you can't take the funding, which I respectfully believe, as do many, that it's safe to do, why would you want to gut an entity that connects the dots for no reason? And so I actually remain optimistic, because I have no doubt the leadership of Bellevue and Health and Hospitals want to do what's right. And I just really hope we get to sit down and talk with them. It was from the beginning, unfortunately, been this is what's happening, this is why, goodbye and good luck. And so Dr. Elijah, he basically got a layoff notice. Dr. Smith, who got one as well. And it's like, why, regardless, why destroy something that's working? Although I will say this, I'm really grateful that services will continue. I sure hope I get, no matter what it is, to be part of it. And I will say our patients are incredibly resilient. But it does beg the question, when you've got a program with such a proven track record, such deep love from those we've served. I mean, it's been incredible. Former patients have been coming out of the woodwork saying, oh, I can't believe this. So I remain hopeful and optimistic that we can still work this out. We can do it in a way that's safe, even if Bellevue ends up just paying for the entire program. But I do think the funding is safe, but that we keep the entity, no matter what you call it. Want to change it to human rights? Okay. I mean, that name, torture survivors, means something to our patients, and we're known. So why you would want to go backwards 30 years doesn't make sense, because we started, were founded, and from the minute we opened our doors have had a waiting list for a good reason, because we're really good at what we do. What we do is needed. And I am really worried, even if you offer these pieces, people aren't going to know. They're not going to come for the services. And they're, even with these isolated things, not going to get the care and the safety and the community they need.
We're almost out of time. The testimonials are really rolling in from people who've had any kind of association with this program. I'll just read one more as another example. Listener writes, as a former asylum officer and lawyer, we relied on this and other programs to provide valid information about applicants in order to help us support and document credibility assessments. So let me ask you a closing question, Dr. Keller, because there's been some concern more broadly about the Department of Health using medical data as a tool for immigration enforcement. You know, there was an incident just this past weekend of ICE bringing a man they tased to Wyckoff Hospital in Brooklyn, and their presence there sparked a big protest. A bunch of people were arrested. Now, of course, that's a very different case than what Bellevue is facing right now. Their concerns seem to be more theoretical at this point. But as someone who works closely with asylum seekers as a physician, is there a sense more broadly that medical institutions are going to increasingly become sites of immigration enforcement?
I think that fear is really well founded. But the way to address that, and actually with our program, we don't collect or share that identifiable information. So they may get it separate, and Bellevue Hospital needs to do what they need to do to protect it. But I don't think that's the answer. And I will say, in terms of what people can do, I think, yes, speaking out to the heads of the hospital and the city about this. There's actually a documentary about our program called Transcendence that later this month is going to be shown at Tibet House. But I think even in these scary times, we need to remain true. We need to remember that adage that Ben Franklin said: we either hang together or we hang separately. And our patients are counting on us more than ever. Once a week, one of our patients is picked up by ICE. But because they have the program, we're like their first call. And then advocate for medical and health reasons to get them out. When we get them out, they may have lost their place in a shelter, and we fix that. So just let us do what we're really good at.
Ibrahim, can you say anything from your personal experience or that of anyone you know, how this program, which is based at a hospital, so it's officially about health, has also helped in the legal context?
Yes, so many people I have met them here in the country. They've gone through the same program, and then they get the help, and they are very happy with the program, as I am very, very happy with the program. And then I feel very, very supported, and they help everyone. Like we build a family there. Like this place is like a home to us. We go there and we meet there, and we have a weekly season. We go there and we talk on everything. And then this program is very, very support, and I hope the hospital change their decision.
Let me just throw in one addendum here, Dr. Keller. Does HIPAA, the medical privacy law, protect the patients in this program from federal immigration enforcement meddling, or doesn't it apply to that? Or maybe it's the Trump administration, they don't care anyway.
It certainly does. I mean, there are no guarantees in this world. I'm just saying this is not the way to make our patients safe by undermining a space, not just the services, but a space in a community where they feel safe. I think we can have both. I can't promise what will happen. I do know with these funds are as safe as any. And I've been kind of scratching my head because, Bellevue receives a lot of federal funds from Medicare, Medicaid. And in fact, many of the congressional reps have said, I don't understand, there's need for funding now more than ever. Why would you refuse these funds? And additionally, there's a program at another public hospital, and for some reason I don't understand, their funding hasn't been questioned. Not that I want to have that happen to them. We're both needed. And we're also part of this national network of 35 centers. And I'm really concerned if they allow success in taking us down, those other specialized programs will also be a threat. So this is bigger than just Bellevue. This is about a national movement caring for torture survivors.
Dr. Alan Keller, the founder of Bellevue's program for survivors of torture, an NYU med school professor, and Ibrahim, a former patient of the program. Thank you both so much for joining us.
Thank you, Brian.
Thank you. Thank you.
WNYC's journalism and storytelling is heard by millions of passionate listeners. Sponsors of our programming gain our listeners' attention and their respect. Learn about how your organization can support WNYC and WNYC Studios at sponsorship.wnyc.org.